Welcome back. We are glad you're here with us tonight. Now imagine yourself walking through the quiet streets of London on a foggy autumn evening in the early 1800s. The gas lamps flicker weakly, casting long shadows on the cobblestones. The air is thick with the scent of damp earth and coal smoke. Most of the city sleeps, but not everyone. Some move in silence, under cover of darkness, their work best done unseen. Their trade is a grim one, dealing not in goods, but in the dead. Tonight, we drift back to a time when death was not always the end, when the line between rest and disturbance was thin, and when the needs of the living reached beyond the grave. This is the story of resurrection men, grave robbers who supplied the dead to the living, to doctors and students desperate to understand the human body. It is a tale of necessity and indignity, of progress and exploitation, but above all, it is a reminder that even in death, the poor had little peace. Let us begin not with fear, but with understanding. A quiet journey into the past, where the dead still had work to do. Picture yourself as a young medical student in Edinburgh or London, early 19th century. The air in the dissection room is heavy with the sharp tang of preserving chemicals, vinegar, alcohol, the faint metallic whisper of blood long since dried. The wooden floors are stained with years of use, and the large, scarred table at the center of the room holds the subject of today, lesson, a human body laid bare for study. Medical knowledge was advancing rapidly in this era. Surgeons no longer relied solely on ancient texts or guesswork, they needed hands-on experience. But where were the bodies to come from? The law was strict. Only the corpses of executed criminals could be used for dissection. And yet, demand far outstripped supply. The courts could not hang enough people to satisfy the hunger of anatomy schools, and so an underground market flourished. A shadow economy where the dead became currency. The resurrection men, so called because they resurrected the deceased, worked in the dead of night. They moved with practiced efficiency, shovels muffled by cloth, their lanterns dimmed to avoid drawing attention. Fresh graves were their targets, especially those of the poor, buried in shallow plots without sturdy coffins. The wealthy could afford iron cages, moored safes, to protect their loved ones, but the poor? Their rest was far from guaranteed. Imagine for a moment the quiet of a churchyard at midnight, the rustle of a shovel breaking earth, the muffled thud of soil being moved aside, the faint creak of a coffin lid being pried open. No ceremony here, no reverence, just business. By morning, the grave would appear undisturbed, the family none the wiser, the body already on its way to the dissection table. And so the cycle continued, the dead feeding the living turning a blind eye. But who were these resurrection men, and what drove them to such work? That is the next part of our story, which we are diving into. Now, let us turn our attention to the men who walked this twilight path, the resurrectionists themselves. They were not monsters, not in the way stories might paint them. They were laborers, tradesmen of a macabre sort, just driven by the same forces that move all people: necessity, opportunity, sometimes even ambition. Take, for instance, the infamous duo of Burke and Hare. Their names echo through history, though not for the reasons they might have hoped. William Burke and William Hare began as simple resurrection men, digging up the dead like so many others. But why stop at the already departed, when the living could be made to serve the same purpose? Between 1827 and 1828, they discovered a more efficient method. No need to wait for burials when a pillow pressed over a sleeping drunkard's face would do. 16 lives were cut short this way, 16 souls delivered straight to the anatomy tables, fresh and unmarked by decay. It was a dark innovation, one that shocked even those who had long turned a blind eye to the trade in corpses. But most resurrectionists were not murderers. They were men like Ben Crouch, a Londoner who ran his operation with the precision of a businessman. He kept ledgers, negotiated prices, even offered warranties if a body was too decomposed. He would replace it free of charge. To him, this was no different than selling coal or cloth. The dead were simply another commodity. And then there were the sack and mop men, who specialized in transporting the stolen dead. They would carry the bodies slung over their shoulders, wrapped in sacks, moving through the streets as if they were mere porters hauling grain. Some even disguised the corpses as drunken friends, staggering home with an arm around their companion, a limp figure whose face was carefully hidden. The resurrectionists had their own codes, their own rules. They avoided fresh graves where mourners might still visit. They preferred pauper cemeteries, where the dead were buried quickly without stone markers to weigh them down. And they never ever took anything from the bodies, no jewelry, no keepsakes. That would make them common thieves, and they prided themselves on being professionals. But what of the surgeons who paid them? The men of science who turned a blind eye to where their specimens came from? That is a question that lingers in the quiet of the dissection room. In the dim light of history, few things are purely good or evil. The trade in corpses existed in shadows, yet it illuminated medical science. Let us consider this paradox with clear eyes. On one hand, the resurrectionists served progress. Because of them, surgeons could study muscle and bone not as drawings in ancient texts, but as living, or rather recently living truth. The great anatomist John Hunter paid resurrection men directly from his own pocket. So valuable were their deliveries to his research. Consider that before this era, a surgeon might complete his training having never dissected a human body. Now imagine being that surgeon's patient. The screams during amputations were not just from pain, but from the crunch of saw on wrong bone. The resurrection trade, grim as it was, helped change this. Yet the cost was steep. In Edinburgh's old town, families would stand guard over fresh graves for weeks until decomposition made the bodies useless to anatomists. The poor lived knowing that even death might not spare them in dignity. Some took to burying their loved ones in secret, and unmarked plots only they could find. The surgeons knew, of course they knew. Men like Sir Astley Cooper, who had become Queen Victoria's personal physician, openly admitted paying for bodies while lecturing at Guy's Hospital. The law does not prevent us from obtaining subjects, he once told students. It only makes us pay more for them. Here lies our paradox. The same hands that stitched up living patients by day paid for stolen corpses by night. The same medical schools that produced life-saving doctors created demand for grave robbery. Progress has always had its shadows. And in those shadows walked not just the resurrection men, but others who saw opportunity in this morbid economy, some with far darker intentions. Beneath our modern cities, hidden under layers of concrete and time, the earth still holds secrets from this dark chapter. Let us listen to what these silent witnesses might tell us. In 2006, construction workers near the Royal London Hospital uncovered something unexpected. As their excavators bit into the earth, they revealed not pipes or foundations, but bones, hundreds of them. Archaeologists would eventually identify nearly 300 skeletons, many showing clear signs of anatomical dissection. These were the forgotten subjects of early medical study. Some skulls bore the precise circular cuts of trepanation practice. Long bones showed the fine scoring of student surgeons learning their craft. Most poignant were the remains showing both dissection marks and autopsy cuts. Used first by doctors trying to understand cause of death, then by students learning anatomy. But how did these bodies come here? The answer lies in the soil itself. Chemical analysis revealed high concentrations of mercury and arsenic substances used to preserve specimens. Some bones showed green discoloration from copper coffins meant to deter resurrectionists. Yet here they were, in a pit behind the hospital. Their copper protection failed or ignored. Modern archaeology allows us to reconstruct their stories in astonishing detail. Isotope analysis of teeth tells us where they grew up. Skeletal markers reveal lifetimes of hard labor. Some show healed fractures from workplace accidents, perhaps the very injuries that eventually claimed their lives. One skeleton stands out, a young woman in her 20s. Her bones tell a tragic tale: childhood malnutrition, evidence of rickets, then years of factory work. But most striking are her hands. The right shows multiple healed fractures, the fingers crooked from repeated breaks. Was this the cost of operating dangerous machinery? The price of survival in industrial London? We'll never know her name. Like so many in unmarked graves, she was someone's daughter, perhaps someone's mother. Now she is specimen RLH 247, her body having taught generations of surgeons long after her death. These archaeological finds force us to confront uncomfortable questions. Was this exploitation? Or was it the necessary price of medical progress? The bones themselves offer no judgment. They simply are, silent witnesses to a time when the line between student and resurrectionist, between medical necessity and moral transgression, was blurred beyond recognition. As we leave these quiet ruins, let us remember that every medical advancement we take for granted today came at a cost. The question is not whether the price was too high, but whether we've honored those who paid it. As we've seen, not all graves were treated equally. There existed a hierarchy even in death. While the poor slept uneasily in shallow plots, fearing the resurrection men's shovels, the wealthy rested secure in their ironclad tombs. This contrast reveals much about the society that created it. Walk with me through London's Bunhill Fields burial ground. Here the middle-class merchants and minor gentry buried their loved ones. Notice the sturdy headstones, the thick coffin wood, the occasional iron railings. These were deterrents, yes, but also statements. In death, as in life, a display of means, a declaration that some bodies were simply worth more than others. Now let us travel to St. James's Piccadilly, see the grand monuments, the massive stone sarcophagi. These were not just tributes, they were fortresses against the resurrection trade. The very richest families went further still, installing mort safes, iron cages that encased the entire coffin underground. Some even employed night watchmen to guard their dead for weeks, until decomposition rendered the bodies useless to anatomists. The cost of these precautions was staggering. A simple mort safe rental might cost £5 more than many laborers earned in 6 months. A full-time grave watcher could demand £10 for 2 weeks' work. For perspective, a resurrection man typically earned just £1 per body delivered to the anatomy schools. This disparity extended beyond the grave. The same wealthy families who could afford such protections often sat on hospital boards or funded medical schools. Some were even related to the surgeons purchasing corpses. It was an uncomfortable truth rarely spoken aloud that the privileged class benefited from a system that primarily preyed on the poor. Yet even among the poor, there was resistance. Some parishes banded together to purchase communal mort safes. Others developed elaborate decoy funerals to mislead resurrectionists. In Scotland, mort houses were built secure stone buildings where bodies could safely decompose before burial. These small acts of defiance showed that dignity in death was not a privilege. All were willing to surrender. As we leave these quiet churchyards behind, we're left with a troubling realization. The fear of grave robbery didn't just expose the vulnerability of the poor. It revealed how thoroughly class distinctions permeated every aspect of society, even following its members beyond the veil of death itself. As our journey through this shadowed chapter of history draws to a close, let us consider how these practices shaped the world we know today. The Anatomy Act of 1832 finally brought change. Pressured by public outrage over cases like Burke Hare, the government established legal means for medical schools to obtain cadavers. Unclaimed bodies from workhouses and hospitals would now supply the dissection tables, ending the resurrectionist trade. Yet the solution carried its own moral weight. The poorest in society still bore the burden, their unclaimed bodies automatically destined for medical study. The wealthy could still rest undisturbed in their family vaults. The fundamental inequality remained, only the methods had changed. Today, when we visit a doctor or undergo surgery, we benefit from knowledge gained through these difficult years. The detailed understanding of human anatomy, the refined surgical techniques, all trace their roots back to those dimly lit dissection rooms. Modern medical ethics have transformed how we approach such matters. Body donation programs now operate on principles of consent and respect, a world away from the midnight activities of resurrection men. Yet the questions remain: who bears the costs of progress? How do we balance collective benefit against individual dignity? As you drift toward sleep, consider those unnamed souls who unwillingly contributed to medical science. Their stories remind us that progress often walks a shadowed path, and that every advancement humanity makes carries with it the weight of complex moral choices. Now gently bring your awareness back to this moment, to your room, your bed, the comfort and safety of the present. The struggles we've explored tonight belong to history now, their lessons preserved in medical texts and quiet churchyards. Let the weight of these stories settle like dust in an old library, acknowledged but no longer disturbing your rest. The past has shared its secrets with you, and now it's time to release them, to surrender to the quiet of the night. Until next time, good night and sleep well.